So we're going to be admitting Daphne. She is a female spayed 1-year-old shepherd mix. She's coming in for a spay. So the doctor gives you paperwork. You're going to come in, have the owner fill out all their information, the best phone numbers, the pet's diet, any medications they are on, or any known medical conditions or allergies, a CPR or DNR for any reason of the pet coming in. Make sure a deposit has been taken and the estimate is signed. And then you're going to go over about post-operative infections and anesthesia and the release and authorization form, and they'll sign the bottom of that. And the pet will need a surgical sheet, and we will have all the pet's information, the doctors, the intern, the resident, the procedure, all the pre-medications and the induction agents, and all the monitoring. At the end of the surgery, we have a surgical checklist and a surgical safety checklist. We make sure all that is filled out before signing over to one of the floor techs. This would be our laboratory forms. We put the patient's information, the doctor, and our hospital, and we would pick which test we want to run, and we put it in our fridge, and then the lab comes every 6 hours to pick up a sample. Then the pet gets a cage card with their sticker, their name, the breed, the date, their ID, and all the employees, the owner's information. We put a name tag on them as well. We remove all their collars and leashes. We have the owner in our admit form describe what procedure they're having, and we double check and ask the owner and go into their record and see what procedure they are having. All of their medical records are kept in the computer. Anything previous that they had done here would be in their history, and in their attachments would be everything that they had somewhere else that we're scanning in to add to our other records. Discharges at the end. So for the spay that Daphne's having, we would go over post-operative care, about confining her, keeping her calm, no running, jumping stairs, watch the incision for any infection, any oozing, redness, or swelling, the antibiotics that she would be going home on, and her pain medications all listed, and that's basically it.
So the minimal databases in the text and that we require in our practice, we would get the patient history, the doctor will get her physical findings, and then usually we would do diagnostic blood work and x-rays. If we see that the x-rays or the bloods are abnormal, we might do further x-rays or send out additional blood work such as a pathology or reticulocyte count. So for our spay today, we would be, for our pre-anesthetic protocol, we're using morphine and midazolam. And then for the anesthetic itself, we're going to be injecting with propofol and keeping her down with isoflurane. And the midazolam would kind of help keep the patient under without having to use as much iso. So I'm going to be putting in a log in our control book. It's of tramadol. So I'm going to look at the tramadol tab. This is for patient Shelby DiRienzo. So I put the date, then her name, and reason in hospital use, the amount. She needs 50 milligrams, so it's 1 tablet. The balance would be 747.5. My initials. And then who physically took it, my initials again would be me.
In this video, I'm going to be going over the parts of the anesthesia machine. This is our breathing circuit. These are the tubes that will bring the anesthetic gases to the patient. This would be our reservoir bag that catches all the carbon dioxide. This is our Soda lime canister, this is the carbon dioxide absorber. We do have to change this regularly, and it will turn purple when it definitely needs to be changed. This is our vaporizer. This is where we put the isoflurane in. This is the most common anesthetic gas that we do use. Right here is where you put the liquid of the isoflurane in. You just have to make sure the machine is off. Flow meter. This will tell you how much oxygen is going to the patient. When you turn it, the little ball will go up, and that will tell you what number it's on. This is the pop-off valve, so you would close it, especially if you wanted to give the dog breaths, or you can push here. This would be our pressure gauge. And this is also our suction canister. If you needed suction for anything, this line would connect to if you're doing a scope, and then it would you turn the suction on down here. Also, when the patient is under anesthesia, you would turn the scavenger system on. And these are the lines that would connect up here for the oxygen and our scavenger. We have the vaporizer for the sevoflurane. This isn't a common anesthetic gas that we do use in our hospital. This is our non-rebreather. This is the breathing circuit that we use for our smaller patients and cats. We would take it out of the outlet here in our vaporizer, insert that, then we would take the tubing from here, stick the non-rebreather down as far as it can go. And this part here would be where it would connect to the trach tube. So in this video, I'm going to show you how to use one of the masks to give our patient some oxygen. It has the rubber around it. I'm going to place the dog or cat's muzzle and make sure it's, kind of a good fit so the air doesn't leak out completely. You can use this to pre-oxygenate the patient, or if he just needs a little extra help. Perform a leak test on our anesthesia machine. You're going to hold your finger over the tubing. You're going to inflate the reservoir bag with the oxygen, and you're going to feel it. As long as it's not deflating, you don't feel any oxygen, any air coming from anywhere, you know that there's really no leakage in your tubing. Subcutaneous injection on Louis. You want to take your fingers, pinch, kind of make a tent. And you're going to go right into this pocket. Pull back, make sure you don't get any blood, and then inject. So now we're going to do an intramuscular injection on Louis. You're going to feel for his spine. You're going to go along the muscle right next to it. Again, pull back, make sure you don't get any blood, and then you can inject the sample. And we're going to inject the sample.
I'm going to do a blood flow on his hind leg. It's okay, baby. I'm going to soften his veins. Come on, kitty. Come on, you're okay. Go baby, almost done. Oh my God. It's okay. It's okay. Okay, that's all I need. I'm going to be doing a jugular stick on the little kitten. There we go. I'm going to be pulling blood from his cephalic vein. Boy. Case reroll. Sorry. Good baby. Okay, that's all.
From the saphenous vein in the cat. him just so he cannot get away. So I'm going to be showing how to restrain, draw blood. So for a front limb, with a cat especially, you want to either scruff or hold their head. I'm going to pull the front leg out and then roll the vein over and apply pressure. For a hind limb, he only has one. So we're going to put him on his side. I'm going to scruff him, hold his tail up, and apply pressure to the top of the thigh. I'm going to show how if he was to go into cardiac arrest. I'm going to face him towards me, put my hand under his chest. My other hand will go here and start compressions as someone else is breathing for him through an endotracheal tube. I'm going to do a physical exam on Louis. I'm going to check his face, his gums and his teeth, his eyes, inside both of his ears. I'm going to feel his body, feel all his lymph nodes. I'm going to palpate his abdomen. Feel the lymph nodes back here. Listen to his chest and his heart. And that would be a physical exam. To apply a muzzle, I'm going to face Louis away from me. The longer side is going to go up to cover his eyes. And slip it over his face and secure it snugly over the back of his ears. chambers. We can use this chamber if an animal needs to be in oxygen or to sedate a patient that's not very easily handleable. So what we would do is we would place our patient, probably a smaller one, into the box. We close it. Make sure it's latched good so that oxygen or anesthetic gas doesn't leak out. And depending if he needs anesthesia or just oxygen, we would turn on the anesthesia machine with the oxygen, and that's how he would receive it or be anesthetized. Okay, so now I'm going to be intubating and knocking down Oatly. She's having a spay today. So we're using propofol as our induction agent. Maybe using a laryngoscope to help. We can measure by checking her nose diameter and from her shoulder blade. This is a size 9. Tie it in. And I'm going to inflate her cuff. I'm going to squeeze it a little, make sure it's not too tight. And hook her up to her oxygen and the anesthesia. I'm going to lube her eyes. Start shaving, prepping for a spay. Okay, now she's all clipped and ready to be spayed. So now I'm doing a pre-scrub. I'm just gonna fill her with some alcohol.
I'm going to be moving her into surgery. I'm going to hook her up to the oxygen. She's on a ventilator. It gets set by her weight. Yeah, tie her legs. I'm going to hook her up to her pulse ox to check her oxygen saturation. ECG lines to check her heart rate. And a blood pressure cuff to check her blood pressure. Then we have fluids throughout the surgery. Okay, I should be good. Good. Her surgical rate is 10 mils per kg, so she'll be set to 250 mils an hour. So funny. It looks even weirder on here. So I'm going to be scrubbing in now. I'm going to open everything up.
Take one.
Take 20. Alright, you can, oh wait, you can start. Okay. So I'm going to be scrubbing in. Start with my fingernails. Yeah.
Attention germaphobe, Top Job Tech, I will share 3 unexpected germ spreaders. Next, today's intelligence provider. Comprehensive state-of-the-art services, insurance management, Mercy Medical Center, Medical Center. Today's Mercy delivers the most advanced imaging and minimally invasive diagnostics. Mercy is the first in New York State to offer molecular breast imaging and MRI technology. MRI is a proven effective screening method to supplement mammography, including early detection and clinic. Visit mercymedicalcenter.chsli.org. Mercy is a member of Catholic Health Services and Allied Patient Session for 40 years. Millions of people have lost weight fast with a clinically proven sleep fast plan. Now it's even easier with the all-new sleep fast advanced nutrition. Up to 20 grams of protein, love and as low as 1 gram of sugar. Just replace 2 meals a day with delicious shakes, bars, or smoothies, and enjoy a healthy meal. And now, add any 3,100-calorie snacks. With the Slim Fast plan, you can see results in just 1 week. Slim Fast and check out Counter Credit Card against germs, keep a pen in your pocket. Use the online band to punch the buttons and sign your electronic signature. Next, shopping carts and department stores. Quick fix, clean the handle and child secret disinfect outright. Will come with a quick handle or plastic grocery bag. One more, the door leading into the bathroom. The study shows that the exterior bathroom door handle has 200% more viruses and bacteria of E. coli than the interior door handle. To avoid picking up those illness-causing microbes, use a tissue roll to the restroom door install and toss it in the trash once you rinse it. Check today's intelligence provider.
Are you looking to extend your living space with your very own Eagle Outdoor Oasis? Look no further. Visit Eagle Out's brand new outdoor design center at 200 Henry Street, Lindenhurst. You'll find thousands of showrooms with the most vibrant
I didn't know you were on.
421-1220 or visit fideliscare.org.
So open it up so you have the one hand on the one side. Yeah, yeah.
Or look for their friendly representatives at events in your neighborhood.
Same thing, you start with your fingers and work your way down to your elbow.
To learn more about applying for health insurance,
Smile.
including Child Health Plus and Medicaid through New York State of Health, the official health plan marketplace, visit www.nystateofhealth.ny.gov or call 1-855-355-5777.
And I just do it again with paper towel. I don't like that wet feeling. Just make sure each hand stays on the same side of the towel. And then flip it around. Just gonna grab a piece. You need to bring it up. Make sure you come up and over. And then turn it around actually. Yep. And then you can have the pins. These are really long for me. You don't want to touch the gown, but my hands are shorter, my arms are shorter than yours. I just want to try and avoid touching the table. And I actually can't do it the way they do it. You know how to go up there?
Just 3.5 miles from the Joe Beach Pier. What's your the bay, the ocean, the marina, dine, dance, drink, and swim. Set sail this summer at Gull Island, Toe Bay Beach. 3 full-service restaurants. Check out the Crazy Restaurant, Long Island's freshest seafood right off the bay, including some creative cocktails. Want a little Latin flavor this summer? Join us at Mango Bay. Mexican fare with a twist. Whether it's a night out with the girls or a day with the family, Mango Bay also features amateur golf. Let's head across the street to the ocean.
Yeah.
Grill, great drinks, and a fun venue.
That used to be on the side of the table, huh?
Long Island Beach features some of Long Island's greatest cover bands.
I think Lucy's got that.
Yeah, I forget how that's true too.
Okay. So now I'm gonna prep the patient and drape her.
Your tab. In between, yeah, you want to look for your indicator.
So the indicator's in here, and it was sterilized.
You can go a little bit more. Yeah.
You can stop it. All right.
So this pulls up. And still. Now you realize lesser drapes a little different.
Oh yeah.
You standing when you open the pack, you always first thing check that.
Quartering no suction?
Cornering of suction, light it. Or you can fix it. So this,
Quartering is over.
you just put this through, just to stabilize it. And then throw this.
Take your one.
Now you gotta be careful. These are, don't drop, these are a little hard to put on.
They're kind of loose but
Some
hard
of
at the
them
same time.
are loose and they fall off.
Okay.
You ready to go?
Yep.
Hello. I didn't even meet the dog.
Oatland? Oatland?
Oh, wait. She's supposed to pass you the
Oh.
scalpel.
Oh, good
Oh.
thing I asked you. Okay. Poor Dr. Kurt.
Okay.
Scalpel.
You can stay up there, though. You can even touch the table. I'll give you some solutions as you make it. Some more.
Do I need to stop this?
No.
She needs to moisten gauze. She needs to do.
What school was this for?
It's in Texas. It's online.
And it was zero PDFs?
00, yeah. What does dog get as far as medications? Just morphine?
Morphine and Rimadyl. Acetazolone.
Oh, I usually don't use Rimadyl, I don't use Cefazolone, it's just
Oh.
morphine.
Sorry.
Maybe penicillin?
You know, we're fishing
Goes in there.
for uterus.
Don't be afraid. You're allowed to touch everything on the table. You should be okay for now, right?
Mm-hmm.
My hand.
So we have Jackie going in for a stay. The monitoring that we use is we'll mark off the percentage of anesthesia she's on, then we'll mark her heart rate, her SpO2, then her blood pressure, also the CO2 and her respiration rate, and we'll monitor that every 5 minutes and until the surgery is over. Alright, that's good. So for my duties and responsibilities as a sterile technician, my job is to drape the patient, using sterility, setting out the tray and the instruments for the doctor, passing instruments, blotting and moistening this tissue, and cutting suture when they need to when they're done, and basically to help the doctor. How I would maintain asepsis and orderly of the sterile field. I would be keeping my hands above my waist as high as possible, not to touch anything that's not sterile, and also to keep the trays and the instruments organized on the table so nothing gets misplaced. So I'm going to be wrapping our emergency pack. I'm going to be taking just a piece of paper towel to put on the bottom. I'm going to line the instruments. Gonna put all the towel clamps together. If I can get it open. Just, okay. together. The scissors. We're gonna put a piece of gauze in the middle of it. I'm gonna put our indicator in to make sure it was properly sterilized. A drape. And I'm going to, we double wrap ours. So our first wrap down. Hold it, pull a little snug, hold it back, and make sure you leave a tab so they can open it easier. Side, and leave a tab again. Tuck it in. And leave a tab. Again, pull snug. Make sure there's a tab. In and leave a tab at the end. That's how you wrap a pack. So this tape I'm putting on, and this just says that it went through the sterilization, not necessarily that it's sterile. And we're going to write the date, my initial, and the kind of pack that it is. So I'm going to be wrapping the surgical gown, so it's going to go inside out, lay it on the table, the arms are in, pull the sides in, keeping the orange strings out, pull it over. Strings on top so they can grab it and keep their sterility. In the middle of the pack, on the gown, I'm going to put the sterile indicator, a hand towel on top so they can dry their hands. Excuse me. Fold and keep a tab. Fold again while pulling snug. Make another tab. Tuck it in, keeping a tab, and then we double wrap again with the tabs. I'm just gonna tape it. On the tape, you're gonna write your initials, the date, and what it is, which is a gown. Okay, so I'm going to be cleaning instruments. I put some of the Spectra soap in a container with water, and I put my instruments in. Now I'm going to take them out using one of our scrub brushes. Scrub all around. And I'm going to put it in our ultrasonic cleaner. And I'll do it for all the instruments that can go in there. Make sure there's no blood or anything on the instruments. And then I close it and set it for 15 minutes. And when this goes off, I'll rinse them, let them dry, and then I'll pack them. So I'm going to autoclave. I'm putting our pack in, and I'm going to fill it with water. Now I'm going to close it. I'm going to set it between 250 and 270 degrees and turn it on for 15 minutes. So I'm going to show that the pack is sterile. You can tell that it went through the sterilization because of the stripes. So I'm going to open it. And to tell if it's sterile, you check the indicator and make sure that the black line went all the way into the accept, which it did. So that means that this was properly sterilized. Some suture patterns would be a simple continuous pattern. This is for subcutaneous space. To keep air when you need airtight or fluid tight, and that position is needed. Another one is a forward interlocking. This is mostly used in larger animals and is a very strong suture line. Another one would be a simple interrupted. It's the most used. It's easy and quick. It's to close the skin and the muscle layers. The next one would be vertical mattress or far, far, near, near. It's a stronger suture pattern in areas of high tension, but it's very time consuming. This would be Tuat blue monofilament. It's a tapering needle. It's one of the types of needles, but this suture is non-absorbable. It's synthetic, and the higher the number, the smaller the suture is. But the next one would be chromic gut. This is absorbable. It's made out of collagen or beef tissue. This is a natural suture. The 1/0 PDS is a violet monofilament. This is absorbable, but it is synthetic. It's used for soft tissue, and this is a reverse cutting needle. This is a 3/0 black monofilament nylon suture. It's a reverse cutting. It's synthetic and non-absorbable, and this is for soft tissue, and it's a nylon suture. This is the 5/0 polysorb braided. It's a soft tissue. It's absorbable, it's synthetic, and this is a cutting needle.